Welcome to Plain English Public Health Weekly Report. I am Richard Greenland, and today is May 29th, 2020. As usual, we'll start with our statistics on COVID-19. Currently throughout the world, we have just over 6 million cases, including about 366,000 deaths. In the United States, we're currently at nearly 1.8 million cases, with almost 105,000 deaths. We did cross that 100,000 death threshold this past week. We have more good news about COVID-19 this week than we do bad news, and so we might as well start with the bad news to get that out of the way. Last week we talked a little bit about herd immunity. A few new studies were released that show that we're nowhere near the antibody coverage that we need for herd immunity to take effect. In fact, the New York Times brought some of those studies together and put together a little infographic that shows about where we're at. On the screen, you should see in the upper left-hand corner, that is a concentration that we should have in order to have herd immunity. That's about 60%. It does vary depending on the disease and who you ask, but 60% is a good estimate. The city with the highest concentration of people with antibodies in their system, at least that we know of right now, is New York City, and they're just under 20%. Other cities that were hit hard throughout the world are at even lower percentages. Sweden, you can see Stockholm down there in the bottom row. Sweden actually decided to try doing herd immunity in their country, not doing a whole lot of the social distancing or anything. And they actually have a lower percentage than most of the cities in the studies. Now this is good from the perspective that they just don't have as many people that got infected, but it is actually still a pretty high percentage of people being infected, and they don't get the herd immunity that they were going for. As I mentioned last week, these herd immunity studies do assume that we'll be immune if we have antibodies in our system. That's a pretty good assumption, since that does typically tend to happen with viruses, but it's not infallible. We have not been able to prove that yet. No studies have been able to prove that just yet. They're still working on that. And also, as I mentioned last week, it's most likely, we're most likely not going to reach herd immunity at all until we can get a vaccine, which again will probably not be available until at least the beginning of next year. The World Health Organization, or WHO, has stopped a trial for hydroxychloroquine. Hydroxychloroquine, started out as an anti-malaria drug, and a lot of people thought that it would work very well for COVID-19. President Trump has even stated that he currently takes it as a preventive measure. Unfortunately, the World Health Organization stopped the trial on it because there was a significant increase in risk of death and heart problems for those taking it, compared to those that were on a placebo or some other drugs. So far, no study has proven that hydroxychloroquine actually helps fight COVID-19. The only quote-unquote evidence that we have that it helps is purely anecdotal. No actual studies have been done, just doctors saying, yes, this worked with my patients, which it may have been, but it wasn't carefully studied. It wasn't, they didn't make sure that there were no other factors that might have complicated it and caused the healing to take place instead of the hydroxychloroquine. There just weren't any good studies, and this study that the World Health Organization was doing was supposed to help with that, but because of all the risk of death and heart problems, they had to stop that. So, as of right now, in short, do not take hydroxychloroquine for COVID-19. The only time you would ever take that is if you were, for example, in intensive care, battling for your life, and your doctor decided to use it as a last-ditch effort. And that's really the only time you should ever take that. The next bit of news is somewhat positive and somewhat negative. Two separate studies, one in Wuhan, China, and one on a cruise ship to Antarctica, have shown that more people than previously thought don't show any symptoms when they've been infected with COVID-19. In the Wuhan study, 42% of cases didn't show symptoms, and in the cruise ship study, 81% were asymptomatic. So it's only 2 studies, so it's by no means conclusive, but it does kind of go along with other things that we've been seeing that kind of point towards possibly 50% or higher of people who actually get infected with COVID-19 do not actually show any symptoms. This information can be positive because it means that many more people have been infected than we thought, and so that means that the virus itself is less deadly because there's a lower percentage of people dying from it. Also, the studies show that those who didn't show any symptoms were actually contagious for about half the amount of time that those that showed symptoms were. So that's a good side. The negative side of this is that this means that there are many more people out there that are infected that we don't know about. And even though they may not be as infectious or be able to infect people for as long as those that are showing symptoms, there's still a lot of them out there. They can still be infecting people. So we can't just go by the fact that people are coughing or anything like that. It could be that they're just talking close to you and you could get it from them. So let's go ahead and turn to some purely good news instead of the mixed news. With hydroxychloroquine out of the running for treating COVID-19, some other drugs are stepping up. One of those is Remdesivir. Remdesivir has been shown in studies to shorten the average duration of infection of COVID-19 from 15 days down to 11 days. Now, 4 days might not seem like that much, but it is a significant amount. Basically, the shorter the time that you're infected with the disease, typically the milder the symptoms will be. Also, you'll be less likely to infect others if you're infectious or contagious for a shorter period of time. A new possible vaccine from a company in China has also been tested and even peer-reviewed, and so it looks like this is really going to work here, but it's still early, so we can't tell for sure. But the vaccine it works differently than the one we talked about last week from Moderna. This one does still cause antibodies to be created, though, just like the one from Moderna. And again, that is what we look for in vaccines, because typically that means that it will work to keep us from being infected if we have those antibodies. Again, we're not sure that that's how COVID-19 works, but we think it is very likely. Side effects were similar to current vaccines, meaning basically pain at the site of injection, low-grade fever sometimes, maybe a little fatigue. That's it. Nothing major. So again, it's still early in the vaccine's development, but early results are very promising. Also, in the way of face masks, new research has shown that certain materials can actually help inactivate the coronavirus's ability to infect people's cells. Face masks made from 1 layer of cotton and 2 layers of chiffon created an electrical charge due to static electricity and the rubbing between the two materials. That electrical charge is what deactivates that virus, and then the filtering from the fabric itself also keeps the virus from entering the body in the first place. So they say that combination, as of right now, is considered the most effective material for face masks. Speaking of face masks, let's finish off today's report with some straight talk about social distancing, washing our hands, wearing face masks, disinfecting surfaces, anything we need to do in order to keep ourselves from getting the virus. When we first started learning about the virus, we first were told, wash your hands, disinfect surfaces. It was thought that surfaces were a big source of the spread of the infection. We now know that even though they can be sources of that infection, they are not as big of a piece of it as we thought. The most common way of spreading the virus is through just being in a room with someone for an extended period of time that has the virus. So, for example, if you're just in a room talking with them, even if you're just talking, even if they don't cough or sneeze or anything like that, if you're in a room that's kind of confined and the air can't circulate very well, you're most likely going to get the COVID-19 from that person. It does take a little while. Some estimates say as little as 10 minutes. Others say as much as 15 or 20 minutes is required, and it probably does vary with each person depending on their own immune system. But that is the most common way of getting it. That is why now the strongest recommendations from the World Health Organization and the Centers for Disease Control both state that we need to still be keeping up with the social distancing and wearing face masks. Those are the two most important things. Washing our hands and disinfecting surfaces, still very important. Please do continue to do that. We'd still want to do that even if we didn't have the whole COVID-19 pandemic. But specifically right now, we definitely need to be still doing the social distancing and wearing face masks. This is even in states that are starting to open up. You might not have it as bad as other places such as New York City, but you still need to be careful. As of right now, we are still seeing some indication of a second wave starting in some areas, and we're still expecting another wave to start in areas that it hasn't started. Hopefully, we're proven wrong, but we'll see. It's better to be safe than sorry. So please keep that in mind. Thank you for watching the Plain English Public Health Weekly Report. Again, I am Richard Greenland, and you have a nice week.